that are mouth, nose, ear, urethra, vagina or anus, or through a wound. Okay, there are 4 types of hemorrhages. So class 1, class 2, class 3 and class 4 hemorrhages are classified into 4 groups by American College of Surgery. So why it is important, why this classification is equally important, because there are 2 actually main classifications, first by WHO and second by this. So what percentage, in what percentage blood loss is getting involved in these stages, and accordingly clinically you can manage the things. So this classification means class 1, 2, 3, 4, this gradation is very important. So class 1 hemorrhage involves up to 15% of blood volume. So total blood volume, out of that 15% blood volume is getting lost, then there is no change in vital signs, and fluid. Hello, am I audible? Hello, am I audible?
Yes, sir,
Yes. And fluid resuscitation is not usually necessary. So what happens generally, in very initial stage, that is first stage, no change in vital sign and no fluid requirement, means resuscitation is not required. So the next stage is class 2, that is involves 15 to 13% of the total blood volume of lossing. And in this stage, rapid heart rate will be there, that is tachycardia. With that, reduction in the difference between systolic and diastolic blood pressure, and body attempts to compensate with peripheral vasoconstriction. Skin may start to look pale and cool to the touch. Okay, so in this particular stage, what required? Saline solution or lactate ringer solution, and means blood transfusion is not required, but fluid resuscitation is required. And then class 3 hemorrhage, this involves loss of 30 to 40% of circulating blood volume. In patients, blood pressure gets dropped, heart rate increases, and in this particular stage, what happens? Mental state gets worsens. Fluid resuscitation with crystalloid and blood transfusion is usually necessary. And more than 40% of circulating blood volume, when there is involved of loss of blood, then what? The limit of the body's compensation is reached, and it is very important for prevention of death. Management is very important. So according World Health Organization, there are 4 grades. That is, first grade, no bleeding. Grade 0, no bleeding. First grade, arterial bleeding. Second grade, mild blood loss. Third grade, gross blood loss. And fourth grade, debilitating blood loss. So clinical notes point of view, this gradation is very important. So pattern, what happens when blood escapes from blood vessels? Okay, so there are 3 basic patterns of injury. Yes. If individual is with excellent physical and cardiovascular condition, may have more effectively compensatory mechanism, but if that is not so, if patient is elderly and who is on chronic medical conditions, then compensation, like management gets very difficult. So what is the pattern of blood escape? That is, first is intravascular changes, second is intramural changes, and third is extravascular changes. So changes within the blood vessels, that is intravascular. Intramural changes arising within the walls of blood vessels, and extravascular changes arising outside vessels. Those are brain abscess, brain tumors, that's all. So affecting factors on blood hemorrhage or blood clotting, you can say, because after hemorrhage, blood clotting is very important. So affecting factors are platelets, coagulation factors, RBC, vitamin K, It is required for production of clotting factors. Then most common causes of warfarin related bleeding. Then NSAID's exposure is very much important, one of the factor. Then deficiency of factor 8. So it causes classic hemophilia as well as deficiency of factor 9 cause Christmas disease. And the another common bleeding disorder is von Willebrand disease. Okay, so massive hemorrhage is the very fatal condition. What happens there? When blood loss excluding means when blood loss is very heavy, what happens? Blood volume get decreases. So if blood volume within 24 hours is very much decreases more than 50% blood loss of total volume, or within 3 hours period, or blood loss will be 150 ml per minute, then it is called as massive hemorrhage, and that leads to very fatal condition. Okay. Then thrombosis. The next point is thrombosis. So why thrombosis is important? The formation of a blood clot inside the blood vessel. So what happens when there is a bleeding? Platelet gets aggregated. Okay, and with the help of RBCs and fibrin, clot formation happens. When a blood vessel is not injured, blood clots may form in the body under certain condition. Okay, so when the clot or piece of the clot that breaks free and begin to travel around the body or circulatory system, it is called embolus. So classification of thrombi. There are two major groups of thrombi. What are they? Arterial or white thrombi and venous or red thrombi. What happens to prevent the bleeding or to stop the bleeding? What happens? So this clotting is very important towards prevention of infection point of view, as well as healing. So if there is a inside blood vessel that thrombus happens, then it obstructs the blood flow through circulatory systems. Whenever this thrombus gets break down and it getting converted into emboli, those emboli start circulating freely in the bloodstream. And what happens? Wherever they need the narrow lumen, they get stuck over there, and further supply of the blood gets deprived. Okay, because where that emboli gets stuck up, that lumens get narrowed, or what happens? Completely obstruction happens. So two major groups are there regarding thrombi classification, that is arterial or white thrombi, and second is venous or red thrombi. So arterial thrombi is characterized mainly predominance of platelets, and venous by red blood cells. So what is arterial thrombosis? Arterial thrombosis is the formation of thrombus within an artery. Okay, so what happens actually when you eat fat rich diet, then that excessive fat deposit, where it deposits at, they have tendency to deposit in tunica intima of arteries. So what happens? That plaques formation happens, and when there is a fat rich deposit in the blood vessel wall and plaque formation happens, the arterial thrombosis follows rupture of atheroma, that is a fat rich deposition in the blood vessel. And what happens? Atherothrombosis. Arterial embolism occurs when clots migrates downstream. Okay, and it can affect any organ. So arterial occlusion occurs as a consequences of embolism. So I will explain afterwards what is occlusion. Occlusion is very important thing, and it is very much important towards the further process which is raised by this thrombosis or embolism. It is more concerned with shock and other further complications because of this thromboembolism. Okay, so venous thrombosis. So venous thromboembolism is what? When in venous thrombus or blood clot forms, and that blood clot, what happens, moves freely through that particular vein, and generally it gives rise to DVT, that is deep vein thrombosis. If the thrombus break off and flows towards the lungs, it becomes pulmonary embolism. Okay, so this combination is called venous thromboembolism. Various other forms of venous thrombosis also exist, but some of this can lead to pulmonary embolism. So this is paradoxical embolism. So in paradoxical embolism, it is known as also crossed embolism. An embolus from the venous or veins crosses to the arterial blood system. Okay, and this is generally found only with heart problems such as septal wall defects. And means there is a hole in cardiac septum between artery and ventricle. So this is all about thrombosis. The embolism is a part of thrombosis, but the main classification, and these are the main factors which we have discussed till. And what we have seen, there are two main types: arterial and venous thrombosis. Yes. So embolus. If a thrombus dislocates and becomes free floating, as we have discussed earlier, it is considered as embolus. And means it is a part or piece of thrombus that is floating into bloodstream. There are three type of embolus, that is fat embolus, blood clot embolus, and gas embolus. Okay, so some of the condition which increases the risk of blood clots developing include arterial fibrillations, heart valve replacement, and extended period of inactivity, that is DVT, blood clot, fat globule, and gas embolism are the three types. So thromboembolism, that is a blood clot. So foreign body, when there is in circulation, main causative factor is first traumatic injury. It is inside or external trauma. So have you heard about tamponade vessel from compression or shearing or laceration? So cardiac tamponade is one of the reason of this. Yes. So causes are thoracic outlet syndrome, atherosclerosis, hypoglycemia, tachycardia, hypotension, outside compression of a blood vessel, sickle cell disease, induced G-force which restricts the blood flow and force the blood to the extremities of the body, as in acrobatics and military flying. Okay, so these are the causes. Some more are there: rupture of the significant blood vessel supplying a tissue, arteriovenous malformations, premature discontinuation of any oral anticoagulant, and excessive doses of central depressant like alcohol. Okay, so and one more is tourniquet application. Many of the times this also happens. Okay, so these are the causes. And what are the practical causes which we can find in our practices? That is previous episodes, or obesity, cylindrical lifestyle, then shock, then varicose vein, trauma, uh, mm, long time surgery happens if, then hormonal replacement therapy, uh, then packing or pacemakers, then catheter putting, spinal cord injury. These are the common causes. Okay. which one can find in OPD level. Okay, so thromboembolism. So next topic is ischemia. So what is ischemia? I think there one point is I have to mention one more point, that is examples of embolism, that is renal vein, no example of thrombosis. So renal vein thrombosis, portal vein thrombosis, jugular vein thrombosis. These are the different types of or different picture of thrombosis in the okay. So there is a condition, it is called as brain stroke. What happens that thrombus or emboli, when it gets stuck into supplying artery of the brain, what happens after that artery, the further occlusion occurs. Occlusion occurs means what happens where that particular emboli gets stuck into that capillary, the previous part of that continuous circulatory system get loaded. Okay, and what happens, the distal part doesn't get good blood supply. So because of lack of blood supply, nutrition supply gets deprived. So hypoxia also happens. And what happens if that is in larger vessel, different condition one can see. And if it is in smaller vessel, means in the concern of brain stroke, if there is a smaller vessel, then branches of circle of Willis gets affected. So that way, if there is thrombus formation after hemorrhage, and that thrombus gets converted into emboli circulates freely in the circulatory system, and if it gets stuck somewhere at some narrow space, or you can say in somehow capillary, what happens? So it it will not allow to flow blood through that capillary for that distal part, and it restricts the blood supply. And because of that, what happens, shortage of oxygen as well as nutrition needed for metabolism, it also get deprived, and that is called as ischemia. So it also means local anemia in a given part of a body. Ischemia comprises not only insufficient of oxygen but also reduced availability of nutrients and inadequate removal of metabolic waste. So ischemia means what? It is deprived of blood supply. So deprived blood supply is deprived, oxygen supplies get deprived. So hypoxia forms or hypoxia occurs. At the same time, deprivation of or it reduces availability of nutrients, as blood is the main media to transfer or to carry these all nutrients to every part of the body. So it reduces availability of nutrients and inadequate removal of metabolic waste also. Okay, so sign and symptoms of ischemia. Okay, so there are 6 P's: pain, pallor, pulselessness, paresthesia, paralysis, and oculothermia. So painning, pallor, pulselessness. Paresthesia is an abnormal sensation, typically tingling or pricking, caused chiefly by pressure or means after the damage of peripheral nerves, because every nerve is dependent on the blood supply, means the health of every nerve is dependent on whatever blood supply that nerve gets. So uh, pins or needle type of pricking sensation or tingling sensation happens, then paralysis and inability to regulate one's body temperature. So if without immediate intervention, if uh, for longer time to vital organs ischemia happens, then what happens, necrosis, gangrene get develop within few hours, paralysis happens, food drops happens. So paralysis is very late sign of acute arterial ischemia and signals the death of nerve supplying the extremity. Okay, so food drop may occur as a result of nerve damage, because nerves are extremely sensitive to hypoxia. Limb paralysis or ischemic neuropathy may persist after revascularization and may be permanent. So, what are the causes? What are the causes of inadequate blood supply as ischemia? So, ischemia is a vascular disease involving an interruption in the arterial blood supply to a tissue, organ, or extremity. If untreated, can lead to tissue death. Okay, it can be caused by embolism, as we have seen earlier, thrombosis of an atherosclerotic artery or trauma. Then venous problems like venous outflow obstruction and low flow states can cause acute arterial ischemia. Aneurysm is the one of the most frequent causes of the arterial ischemia, and another causes of heart condition what mitral valve disease, chronic arterial fibrillation, cardiomyopathies, and many more. Okay, so there are some main types of ischemia. So we will see them. First is before that, I would like to explain what is occlusion. When thrombi leads to the pulmonary embolism, an acute arterial occlusion causing the oxygen and blood supply distal to the embolus and it decreases suddenly. Degree and extension of the symptoms depends on the size and location of that obstruction, and this occurrence of clot fragmentation happens in peripheral arterial diseases. So occlusion is that when thrombi leads to pulmonary embolism. Okay, an acute arterial occlusion causes the oxygen and causes the oxygen and blood supply distal to the embolus and decreases it very suddenly. So degree and this extension of the symptom depend on the size and location of the obstruction. Okay, so now we will see what is the cardiac ischemia, because occlusion is the one of the important part in ischemia. So I explain that. So cardiac ischemia may be symptomatic or may cause chest pain. So known as angina pectoris. It occurs when the heart muscle or myocardium receives insufficient blood flow. This most frequently results from atherosclerosis, which is the long-term accumulation of cholesterol-rich plaques in the coronary arteries. What is the next type of ischemia? Both large and small bowel can be affected by ischemia if any artery gets like blocked and blood supply will get deprived. Then for larger intestine, what develops ischemic colitis, and for small intestine, mesenteric ischemia. If it is cutaneous, then what happens? Reduced blood flow to the skin layers may result in patchy discoloration of the skin. If brain is there in ischemic condition, brain ischemia is insufficient blood flow to the brain. Okay, so acute ischemic stroke is a neurological emergency that may be reversible if treated very rapidly in golden hours. Chronic ischemia of the brain may result in a form of dementia called vascular dementia. Okay, so TIA, have you heard about that? It is transient ischemic attack, often called as mini strokes. So, in the cases of limbs, lack of blood flow to the limb results in acute limb ischemia. Then the next topic is infarction. So, ischemia is what? What we have seen, it is deprived of blood supply. Because of deprivation of blood supply, hypoxia happens. Supply of nutrients is not proper. So, removal of waste products is also not in proper channel. So, many type of other symptoms happen. And in the case of vital organs, within or golden period, if you are not treating that ischemia, then what happens? It leads to permanent damage. Okay. So next topic is infarction. Infarction is tissue death or necrosis due to inadequate blood supply to the affected area. It may be caused by artery blockages, ruptures, mechanical compression, or vasoconstriction. So infarction when happens as a result of prolonged ischemia, which is insufficient supply of oxygen and nutrition to the area of tissue. Okay, the blood vessel supplying to the affected area of tissue may be blocked due to the obstruction of the vessel. That blockage may be from arterial embolus, thrombus, or atherosclerotic plaque. So, what are the risk factors for infarction? Hypertension and atherosclerosis. Okay, so there are two main types of infarction. First is white infarction and second is red infarction. So, white infarction is what? Where anemia infarcts are happens, and red is hemorrhagic infarcts. Okay, so what is the important point? One of the important point, when the fibrous cap gets degenerated, yes, yes. So in the risk factor, yes. So hypertension and atherosclerosis are the risk factors for both atherosclerosis plaques and thromboembolism. In atherosclerotic formation, a plaque develops under a fibrous cap. This fibrous cap get degenerated by means when it gets degenerated and it released from macrophages or by intravascular shear force from the blood flow, subendothelial thrombogenic material exposed to the circulating platelets and thrombus formation occurs. So it is very much risky for life saving. So these are the types. Yes, white infarction. So, white infarction affects solid organs such as spleen, heart, kidneys, wherein the solidity of the tissue substantially limits the amount of nutrients, that is blood, oxygen, glucose, which is carried by blood, that can go into the area of ischemic necrosis. Okay, and red infarction generally affects on lungs or other loose organs, that is testes, ovaries, small intestines, and occlusion of a vein, loose tissues that allow blood to collect in the infected zone, tissues with dual circulatory system, and tissues previously congested from a sluggish venous outflow, then rain infarct happens. Okay. So next topic is shock. So shock is the state of insufficient blood flow to the tissues of the body as a result of problems within the circulatory system. First we have seen hemorrhage, then thromboembolism, then we have seen ischemia, then infarction. Now we are going to study shock. So this is the series. So shock is the state of insufficient blood flow to the tissues of the body as a result of problems with the circulatory system. So what happens? Initial symptoms, what are they? Weakness, fast heart rate, increased thirst, anxiety, sweating, fast breathing, and this may be further stages, or this may be followed by confusion, unconsciousness, cardiac arrest, or other complication. Okay, so shock is divided into four main types based on underlying causes. These causes are there, that is low volume, cardiogenic, obstructive, and distributive. So low volume, when there is high, low volume is hypo. Okay, hypovolemic shock may be from bleeding, diarrhea, or vomiting. Okay, so cardiogenic shock may occur due to heart attack or cardiac contusion. Obstructive may be due to pressure or cardiac tamponade or a tension pneumothorax. If there is a pressure from different dimensions to that organ, so then what happens? It obstructive shock generates. So distributive is shock may be due to sepsis, anaphylaxis, injury to the upper spinal cord, or certain overdoses. So how we can do the diagnosis of this shock? It is the combination of symptoms, physical examination, and laboratory test. Generally, what happens? Pulse pressure. What is pulse pressure? Systolic blood pressure minus diastolic blood pressure. So, decreased pulse pressure or a fast heart rate raises concerns. The heart rate divided by systolic blood pressure known as the shock index. If it is greater than 0.8, supports the diagnosis more than low blood pressure or fast heart rate in isolation. So, shock index and pulse pressure, these are the main examinations. Oh, okay. So, symptoms are low blood pressure, decreased urine output, confusion. This may not be always present, but many times. Fast heart rate is common, and those are on beta blockers. Those are athletics, and in 30% cases of those, shock due to intra-abdominal bleeding may have a normal or slow heart rate. Means heart rate is normal or slow, but 30% of cases of those getting this situation. And dry mucous membrane, reduced skin turgor, prolonged capillary refill time, weak peripheral pulses, cold extremities. So this can be the early sign of the shock. So we will see what is the hypovolemic shock. So hypo means it is most common type of, and it means decrease in the volume of blood. So it is caused by insufficient circulating volume. Okay. So the most common cause of hypovolemic shock is hemorrhage. Okay. And when fluid gets decreased, that is children from vomiting or diarrhea is the most common cause, and other causes are burns, excessive urine loss, diabetic ketoacidosis, diabetic other complications. Okay. So signs and symptoms of hypovolemic shock are rapid weak 3D pulse uh, due to decreased blood flow, then cool skin, rapid or shallow breathing, decreased perfusion, evaporation of sweat, thirst, dry mouth, cold and mottled skin. Then next type is cardiogenic shock, the failure of the heart to pump effectively. Okay, so majorly this is due to damage of the heart muscle, and most often from a large myocardial infarction. So other causes are cardiomyopathy or CHF, congestive heart failure, or myocardial contusion, valvular heart diseases. So symptoms are weak or many times absent or irregular pulse, abnormal heart rhythm, tamponade, that is the pressure or accumulation of fluid in the pericardium, reduce blood pressure, shortness of breath, distended jugular vein. These are the main symptoms of cardiogenic shock. Okay. So next is distributive shock. So distributive shock, it is always a low blood pressure due to a dilatation of blood vessels within the body, and these are the main readings regarding temperature is less than 36 degree or more than 38 is within. Okay, so heart rate is more than 90 and respiratory rate is more than um, 20 per minute, and WBC is range is also mentioned, that is it is less than 4,000 or more than 12,000, or 10% bands are present. So this can be caused by systemic infection, moreover, that is septic shock, or you can say anaphylaxis or a spinal cord injury. Okay, so distributive shock, what is the main sign of that? It is very low blood pressure due to the dilatation of blood vessels. So, what are the main positive factors? Septic shock, severe allergic reaction, and spinal cord injury. So, we will go through first septic shock. What is septic shock? It is caused by infection. Okay, so the gram negative or gram positive bacterial infection, or you can say bacterial toxins, or lactic acidosis, oliguria, or an acute alteration of mental status. These are the main symptoms of septic shock. So E. coli, Proteus species, which are the main gram negative bacteria, is cause septic shock, and occasionally neurological effects which are harmful to the body, we can get them. or we can observe. So many times what happens, certain fungi as well as gram positive bacterial also causes this septic shock. Okay. The main manifestation of this septic shock is due to the massive release of histamines, which causes intense dilatation of blood vessels. And yeah, so these are the sign of septic shock. So next is anaphylactic. The pathophysiology of septic shock is what? Systemic leukocyte adhesions to endothelial cells, and it reduces the contractility of the heart. So activation of the coagulation pathways. This resulting in disseminated intravascular coagulation, and it increase the level of neutrophils. Okay, so these are the pathophysiology steps. So signs are what? Again, decreased urine output, altered mental status, abnormal heart rhythms, often fast heart rate, reduced blood pressure. Then next is anaphylactic shock. So anaphylaxis is pratikshipta kriya, we can say. So it is regarding what? It is related with allergens, antigens, drugs, or foreign protein. That's why we are giving test dose. Okay, many of the times when first time we introduce uh, any injection or um, any new medicine to any body, we have to give the test dose, and that test dose concept is taking care of this type of, yes, anaphylaxis, that is that give rise to anaphylactic shock. So anaphylactic shock is caused by severe anaphylactic reaction to an allergen, antigen, drug, or foreign protein, causing the release of histamines, which causes widespread of vasodilation, leading to hypotension and increased capillary permeability. So what are the signs of anaphylaxis? What happens for skin changes, itching, flushing, swelling, wheezing, shortness of breath. It is the letter sign, or it is very fatal sign, but generally abdominal pain, diarrhea, vomiting, lightheadedness, confusion, loss of consciousness. So high spinal injuries may cause neurogenic shock, which is commonly classified as a subset of distributive shock. And these signs typically occurs after exposure to an allergen, and that include this all whatever I have said. These all symptoms. Okay. So endocrine shock is not a separate thing, but many things comes endocrine dysfunction. So uh, we have to go through this type of endocrine dysfunction genic shock. So it is because of hypothyroidism, it is because of thyrotoxicosis, acute adrenal insufficiency, and relative adrenal insufficiency. So hypothyroidism can be considered a form of cardiogenic shock, and people who are really critically ill patient of hypothyroidism, in that reduces cardiac output, and that can lead to hypotension and respiratory insufficiency. Means those who are suffering from shock status and they are having severe hypothyroidism, this complication may get developed. So thyrotoxicosis may induce a reversible cardiomyopathy. Acute adrenal insufficiency is frequent, the result of discontinuing corticosteroid treatment without tapering the doses. Hello, all of you, can you see my slides? My slides are visible or not? Okay, okay, okay. Because here network problem shows, so that's where my voice and slides are proper, then I can proceed. Okay, okay, okay. Yes. So endocrinic complications affects very much in the condition of the shock. So that's why these are very important things to be concerned in the concept of with the concept of shock. So I'm discussing over these all points in this presentation. So next is acute adrenal insufficiency is frequently the result of discontinuing corticosteroid treatment without tapering the doses. Without tapering the doses, what if anyone discontinues with corticosteroid, then what happens? Acute adrenal insufficiency happens. Okay. Or many times, if a patient on corticosteroid therapy without adjusting the doses or to accommodate for that increased requirement, if he or she will not adjust the dose, then it may also result this condition, that is acute adrenal insufficiency. Okay. So the next slide is yeah. So these are the shock types and causes. So type is means low volume, it's fluid, is hypovolemic shock, that is fluid loss such as bleeding or diarrhea. Uh, this is because of cardiogenic shock. Ineffective pumping due to heart damage. Then obstructive, it is because of blood flow to or from the heart is blocked. Then distributive, it is due to the abnormal flow within the small blood vessels, and it contains subtle anaphylactic. So now we will see the four stages of the shock. These are the four stages. What we have seen is there four types, and now we will see the four stages. That is the first initial stage, then compensatory, then progressive, and then refractory. Okay. So initial stage, during the stage, the state of hypoperfusion causes hypoxia. Very initial stage. Due to first lack of oxygen, the cell perform lactic acid fermentation. Since oxygen, the terminal electron accepted in the electron transport chain is not abundant, this slows down entry of pyruvate into the Krebs cycle. Okay. So resulting in its accumulation, the accumulating pyruvate is converted to lactate. Okay, by lactate dehydrogenase, the accumulating lactate causes lactic acidosis. So this is the initial stage. Shock is the endpoint of many medical conditions. So it is itself is life threatening, and it is very difficult to reverse many times. So it affects body in that way, means it affects very progressively, and these four stages are very important for practice point of view, for clinical point of view. So that's why I'm discussing those stages over here. Because what happens generally, there is no any sudden transition from one stage to another. So it is cellular level oxygen supply and all other related chains, these are very much more concerned with this all stage. So this is the initial stage, so we are discussing stages over here. Second stage is compensatory. This stage is characterized by the body employing physiological mechanism including neural, hormonal, biochemical mechanism. Okay, so it is an attempt to reverse the condition. Person will begin to hyperventilate in order to rid the body of carbon dioxide, because there is a deprivation of blood supply, so deprivation of oxygen, so hypoxia. So patient start to hyperventilate in order to rid of the body of carbon dioxide. Okay, because what happens, carbon dioxide indirectly acts to acidify the blood, so the body attempts to return the acid base hemostasis by removing that acidifying agent. Okay. This vasoreceptor in the arteries, they detect the hypotension, and that resulting from the large amount of blood being reduced or you reduce to the distant tissues. And so what happens, this compensatory stages, it get develops to vasoconstriction with mild you can say mild tissue damage and increase in, yes, ventilation. This is hyperventilation. Yes. So next is progressive. So in the absence of successful treatment, because as I said earlier, these are means it is no sudden transition from one stage to another. So in the absence of successful treatment, treatment of previous stage, and the cause is like, a sustained rate, the shock will proceed to the progressive stage. During this stage, compensatory mechanism begin to fail. So what happens? Due to the decreased perfusion of the cell in the body, sodium ions built up within the intracellular space while potassium leaks out. Due to lack of oxygen, cellular respiration diminishes and anaerobic metabolism predominates. Okay, so acidosis gets starts. Bacteria may enter in the stream and risk of, it is actually a risky stage, of course. But what happens? Majority bacteria enters in the bloodstream and infection rises. Okay, so last stage is refractory. The vital organ have failed and shock can no longer be reversed. Brain damage and cell death are occurring, and death will occur at last. So these are the four stages function wise, and gradually they develop. So management at that stage of initially means, or at the stage of first level of shock, it is very important to prevent the further deterioration in that patient. So whatever we have seen in this today's lecture is hemorrhage, then blood clotting, then what is embolism, what is thrombus, then ischemia, infarct, and shock. Okay, if any question is there, let me know. All questions are welcome. I have tried my best to simplify this topic. If all of you will go through this presentation or whatever I've written on the slides, and if you will cover only those points during your exams answers, then you may get good marks, because actually this is not means when we do presentation we should write very less on the slides, but I know in future you can read these slides as a reference notes also, so that's why so many points I have mentioned on the slides. So these slides are going to be very beneficial for exam point of view also. If any questions, yes. What is irreversible cardiomyopathy? And ma'am, meaning of aneurysm. Aneurysm means blood, means when thrombus freely floats in the circulatory system. It is like blood clot. It is blood clot is called as, yes. There are many types of blood clots. I have said gas embolism. Uh, uh, Hello, am I audible? Again, yes, internet. Okay. Let me check. So, three types are there, as I have earlier discussed: air embolism, gas embolism, what is air embolism, fat embolism, and clot. So, cardiomyopathy are not reversible in advanced stage, because this all dysfunction of cardiac muscles is because of what? Ischemia. And if that ischemia is not detected in proper manner or in early stages, what happens? Deprivation of blood supply and the hypoxia, uh, and accordingly or related, because of that hypoxia, deprived nutritional supply and removal of waste products, this all change happens, or this forms a vicious cycle. And after certain stage, these cardiomyopathies are not reversible. So in early stage, you can treat them, treating this causes of obstruction. If there is an atherosclerotic condition or any other problem is there, is that thrombosis? Yes, thrombosis. So these are the three. Wait, one more question. Yes. These are the thrombus: blood clot, fat globules, and gas embolism. These are the three types. Any more questions are there? Yeah, hyperventilation. Hyperventilation, it comes in progressive stage of shock. What happens when there is a deprived of blood supply or the cause is not treated? Septic shock occurs. Means, see, I will explain. When patients moves towards, yes, these are the stages of, see, these are the types of shocks and these are the stages of shocks. So what is the main causative factors of shock? That is deprivation of blood supply by many causes. So what happens when there is a deprivation of blood supply? Hypoxia. So that patient is not able to get proper oxygen for his or her activities or for breathing. So he tries his best to get that oxygen and try to compensate that blood pressure and all system by taking more and more breath. So it causes hyperventilation. Here one slide is missing. It is there, yes. As a result of acidosis, yeah. So compensatory, there is a result of acidosis. The person will begin to hyperventilate in order to rid of the body of carbon dioxide. So every time there is a percentage of every gases in the body. So for your health or maintenance of the health, whatever gases are present, there is always a certain percentage is very necessary for the normal physiology. If that percentage gets disturbed, then what happens? That results to uh, start of the channel of acidosis, and for that, to compensate that, hyperventilation gets starts. And to rid out of that body or carbon dioxide, is because it is indirectly acts on acidifying the blood, no? So to get rid of that, that person or that patient gets hyperventilated, or they start going in that stage. Okay. So I have tried my best to make it as far as possible very much simple and simplest, because this is very important for your practical point of view, understanding point of view, as well as exam point of view. So all of you will go through these slides as a notes, then it will be more than enough. Okay. So I think time is over now. So now I'm ending this meeting. Okay. Hello. Hello.